A very good morning. Honorable Health Minister of Sikkim, Shri G.T. Dungalji, Shri Siddharth Bhattacharya, Shri Thawasilan K., Professor Ashok Puranik, Dr. Vibhuti Bodthakur, Dr. Srinivas Rao Pulijala, and all our esteemed participants, my friends from the media, ladies and gentlemen, I am immensely delighted to join you all for this very, very important session under the Rising Northeast Investor Summit 2025, which is focused on advancing healthcare in the northeast of India. And I consider it not just a thematic conversation, but a national priority. Under Prime Minister Narendra Modi ji's leadership, you've all witnessed in the past 11 years how we've been working very hard to grow the northeastern part of India, and we consider it a very, very significant part of the country's development journey. And today we have a very big resolve, a big dream in front of us, that is of creating a developed India by 2047. And when we say developed India, it means developed Northeast. And health is a very important pillar of any country's development journey. Today, as I stand here before you all, I would like to reaffirm Government of India's unwavering commitment to ensure access to quality and affordable healthcare to all our brothers and sisters in the northeast region of this country. Friends, India's healthcare sector has been one of the fastest growing in the world. However, the Northeast has remained unserved for a long time. This is a region which is home to 45.7 million people and covers approximately 8% of India's landmass. But we also understand the unique obstacles and challenges that it poses to healthcare delivery when it comes to the aspects of the northeast regions like a hard geographical terrain, weather conditions, and the ethnic and cultural diversity. Over the years, Government of India and Ministry of Health and Family Welfare has made tremendous strides in improving the healthcare ecosystem. But despite all the vast improvements in the public healthcare ecosystem, there are still a large number of people from the Northeast who've been traveling to different cities of the country, Delhi or Kolkata, even Assam and other parts, the bigger cities, to avail better healthcare facilities. So there is definitely a demand and supply gap, but I do not consider it as a weakness. In fact, that's where a powerful investment opportunity lies. There is so much to do in the Northeast region when it comes to improving the healthcare ecosystem. And the private sector can actually intervene and play an important role in upgrading the secondary and tertiary healthcare infrastructure, improving the diagnostic services, and even providing these specialist services in the region. We mustn't forget that this is a region where now the economy is improving very fast. So there is a rising middle class, and they have increased awareness of health and wellness. They have a purchasing power, so there is a good demand. And nationally also, it's a profitable investment in the national context. Also because India's healthcare sector is growing very fast, as I said before. So it would be very profitable for the private sector to get into exploring this untapped frontier, which is the Northeast. And right now, there is a very low level penetration, so not many players. So whoever is the first mover is going to benefit from not just the strong local demand, but also limited competition. And there are so many opportunities that exist. Yes, Government of India, along with the state governments, we have been able to scale up the infrastructure, whether it is in terms of setting up cancer care facilities or the Ayushman Arogya Mandir, where we are strengthening the primary healthcare structure or diagnostics, or multi-speciality hospitals, scaling up medical education, everything. But there is still a big scope for the private sector to intervene. So I would say that there are still many opportunities which exist in terms of setting up maybe multi-speciality hospitals in tier 2 cities, or daycare cancer centers, even dialysis units, trauma centers. These are so many opportunities that still exist for you and which are yet to be explored. So that is a big scope. Another thing I would say is that, Honorable Health Minister also mentioned, Government of India's very prominent initiative has been in terms of e-Sanjeevani, telemedicine. And telemedicine and digital health becomes very viable, especially in the northeast region, where the terrain is very difficult, where the accessibility issues are a constant feature. So the digital health investors do have an opportunity to set up some very asset-light business models, and which are scalable also, because I said the penetration of the private sector is quite low, the competition is very low. There is so much that you can do, whether it is tele-ICU services, tele-radiology, tele-consultation, AI diagnostics. There is just so much that you can think of and do to serve this especially very, very potential area. Government of India, like I mentioned before, has taken many flagship initiatives, and two of them are, I would like to mention, are the National Health Mission, through which we are trying to strengthen our primary as well as the secondary healthcare facilities, and also the Ayushman Bharat PMJ. So that is basically to provide the biggest health assurance, especially for secondary and tertiary hospitalizations and care. Here also, I would say that the private sector can intervene by supplementing Government of India's efforts and bridging the gaps that exist in ensuring universal health coverage. So one of the ways in which you can contribute is by setting up, say, empaneled hospitals or clinics under PMJ. That could also be one opportunity. And in addition to this, we can actually, Ayush is a separate ministry, but I would like to highlight here about the Ayush mission also, because Government of India has decided to support the setting up of 1,000 Ayush wellness centers and 100 dispensaries, particularly in that northeast region. And northeast is an ideal destination when it comes to wellness tourism. So it's a serene environment, as Honorable Health Minister was also pointing out. The weather is very pleasant. So with that scenic beauty and with that peaceful environment, it is a very ideal destination for promoting wellness tourism. So when you can associate with the Ayush Ministry, and there could be that wellness tourism chains that could be done. And another big idea is of medical value tourism, because Northeast is very strategically located. It has proximity with countries like Bhutan, Nepal, Bangladesh, Myanmar. So we have that ability to attract medical tourists who would like to club medicine, healthcare with travel and leisure. And this could be one of the ways of promoting our Northeast and also providing wellness and healthcare facilities, not just to the locals who, as I said before, do have rising income and do have a need and a desire for wellness, but also tourists from the neighboring countries could be attracted. Another very important sector could be pharmaceutical manufacturing. Now, we just went through this presentation where it was shown that, some very unique kind of medicinal plants and herbs only grow in this region. And this is such a beneficial investment opportunity. Northeast is slowly emerging as a hub of pharmaceutical manufacturing, of course, because of the strategic location and the abundant natural resources, and also the policy backing by the state governments and the Government of India. So lots of pharmaceutical companies have already stepped into the Northeast, but there's still a huge scope, a huge one, because an investment into this area could bring greater returns. whether it is setting up of, say, an API or a formulation unit, or maybe setting up a herbal product or Ayush medicine processing plants, or making use of leveraging the PLI scheme that we are running under Department of Chemicals, which falls under the Ministry of Chemicals and Fertilizers of Government of India, or exporting generics and herbal medicines to the neighboring countries. So opportunities are huge. It depends on us how we want to make use of it, because these pharmaceutical manufacturing units, if they once set up there, they'll not just contribute to the concept of health and wellness. It's a business opportunity. It will also contribute to the economy of the region. So that's also another huge opportunity. And not to forget that there has been a big scale up of medical education. Now there are big medical colleges coming up. So you have that local and stable pipeline of this talent also, because for a long time this has remained a challenge that local talent was not available. So people had some reservation going to the Northeast, but now that challenge has also been overcome with so many of the new medical colleges coming up. So there is a whole lot of availability of the local talent pool. And here I would say differently that we have come up with lots of medical colleges and people are getting MBBS degrees, everything. But there is also a scope for setting up, say, allied healthcare institutions or nursing institutions. That's another dimension to it. So there is a scale up, there's an expansion of the medical education also. And when we see all this in totality, we see a very bright picture, a very optimistic picture. And I'm here to urge you all to come forward and explore and harness the huge potential that lies in this region of our country. Rising Northeast is an opportunity for us. It's about rising together, rising with India, rising with the Northeast. So no longer Northeast is on the margins. It is very much the priority of the Union government today, and we consider it a critical pillar of our Act East policy. So I would urge each one of you to make best use of this opportunity and act on the moment, because it is really the time to act and contribute to India's equitable growth story. And there is just so much that we can do, not just to grow our Northeast region, but to contribute to the bigger dream of a developed India by 2047. So these were some of my ideas that I wanted to share with you. I see a lot of optimism and energy, and I'm sure that is all going to translate into the development story of the Northeast region of India. With this, I convey my best of wishes to all of you who have come from every nook and corner of the Northeast or maybe country. And I just hope that this summit leads to some very, very fruitful outcomes. Thank you very much. Jai Hind.